Okay, congratulations, your splints are now out. I wanted to create this video so you have a clear understanding of how to take care of your nose moving forward. So the first thing we need to do is now you can start gently blowing your nose. We don't want you to be afraid of that. We don't want you to go crazy, but we want you to start gently blowing your nose. The most important thing is to keep your nose clean. You're using your saltwater spray before. We like those Med bottles, those are great. This time, I want you to use it a lot more often. You can squirt it in your nose gently and then blow your nose gently. What you don't want to do is you don't want to go too crazy and blow so much irrigation that it goes into your ears. To avoid that, when you use your nasal spray, make sure you point it towards your temple area, your eyes, and not necessarily straight back. That makes it a little bit easier for you. The last thing is to watch out for bleeding, okay? Bleeding, you may have a little bit of drainage. It may come out a little bit bloody when you blow your nose or when you irrigate. But make sure you get one of these cards and go ahead and take a picture in the back of it. In case you do bleed, it gives you different techniques on how to deal with it. Remember, bloody drainage is normal, but if it starts dripping out like a faucet, what you want to do is, if you have a little bit of Afrin, you can squirt it in your nose. You can put it on a piece of cotton and squirt it in your nose, but just hold it and pinch it. If it doesn't stop after about 5-10 minutes, you can go ahead and give us a call. Again, just like afterwards, we're available to you 24/7. Any time of the day, we'll pick up and we kind of guide you through the process. So just make sure you can post this on your refrigerator, but at least, or take a picture of it so you have it. That way, if you do get some bleeding, don't panic. It's not a big deal. We can take care of it 24/7 anytime. The other thing I want you to do is I want you to start using your steroid spray. So some of you may have Flonase or fluticasone. That's the most common, whatever we've given you. This is the time to start using it to reduce that inflammation. So you're going to spray it again in your nose, away from your septum. 2 puffs twice a day is our typical rotation. You also may feel increased congestion. I know right afterwards you'll feel it'll be wide open. It'll almost be too open. After a while, you'll get some swelling in your nose as it kind of readjusts, and you'll get a lot of crusting and scabbing. That's all normal. Don't be afraid of the stuff that comes out of your nose. You oftentimes get all kinds of creatures that come out. That's normal. Don't be scared of that. You don't have to take pictures of it. We've seen it all. But just note that when you blow your nose, you can make it a little bit of bleeding, a lot of different type of stuff. All good, but make sure you continue to blow your nose. Last but not least is make sure you have an appointment after 1 week. Oftentimes when patients have their surgery, they feel great. They don't want to come back and see me. I get it, I understand, but I need to see you at least one time, if not a couple of times, to make sure everything is in good position. We may require another additional cleaning. And again, it's not uncommon after your operation that feels like you're stuffed up again because of those clots and those scabs. And that will be easily remedied by your first post-op visit when we take out and clean out your nose. Very good, congratulations. If you have any questions, concern, give us a call.